Our next session is a fireside chat called Connected Technologies, Improving Public Health. Dr. Maria Ryan, Vice President and Chief Clinical Officer at Colgate-Palmolive Company, and Dr. Jessica Mega, Co-founder and Chief Medical and Scientific Officer at Verily, and a Research America board member, will have a discussion led by Moderator Nancy Brown, Chief Executive Officer of the American Heart Association, and also a Research America board member, about an important partnership between Colgate and Verily. Nancy, over to you.
Hello, everyone. Thank you for joining us today for Research America's National Health Research Forum fireside chat called Connected Technologies, Improving Health. I'm so excited to be here today with Drs. Maria Ryan and Dr. Jess Mega. They are going to bring amazing expertise for this. Jess and Maria, thank you so much for being with me today.
Thanks, Nancy.
Today, we're going to discuss the importance of research and how connected technologies can accelerate understanding, diagnostics, and treatments. We'll talk about the importance of reaching diverse audiences in the process, and we'll also discuss the intersection of oral health and overall health and well-being, and how oral health can be a contributor to chronic diseases like cardiovascular disease and stroke. And finally, our goal is to make sure that you, our audience, have a better understanding of oral health and what everyone can do to improve their oral health. This is so important because we know health literacy is key to behavior change and living longer, healthier lives. Jess, let me begin with you. Verily has been combining data and human-centered design to help people live healthier lives. We also know that partnerships are a centerpiece of your work, which we'll get to a little bit later. But first, let's talk about your work at Verily and how do patients and the public benefit?
So Verily is Alphabet's company focused on precision health. And the way that we think about it is that the world of health information is going to increase exponentially. What we think about health information, maybe I as a physician might take some notes, put it into a chart, but we know that people are experiencing health every single day. And they're expected to be about a 1,500-fold increase in what we even call health information. The second thesis is that information is important both inside the four walls of a hospital, but also outside. And how do we use technology to link those environments? And then finally, creating models to make precision health a reality. And your question about helping patients is so important. And the way that we've done that is really linking research and insights to care. And we'll be talking about that more today. But we know that any drug or device or digital tool or even a new care pathway, we need the right evidence behind it in order to impact the patients and clinicians. And we started with a study called the Baseline Health Study, which is one of the most comprehensive dives into human physiology. And through this endeavor, we work directly with participants and we've built out tools to create longitudinal data sets. And by doing this, we're trying to provide research more broadly, democratize the insights, and understand comprehensive health. And I think that's why we've been so excited to partner with Colgate, because we know that there are many aspects of health that we think about. We think about cardiovascular health, we think about diabetes, but we need to pay attention to oral health as well. So that's how we hope to help patients, by democratizing research and thinking about health in a comprehensive way.
Thank you, Jess. You know, having been a partner with Verily since the very beginning of Project Baseline, it's really incredible to have this vision and to think about how much the world changes every single day in terms of access to information and the need for this integrated view of the patient. And Maria, that's why we're so glad to have you with us today. You know, obviously at the American Heart Association, we know from our science that people with severe gum disease might be twice as likely to have increased blood pressure. We also know that gum disease is associated with a higher rate of strokes caused by hardening of large arteries in the brain, as well as severe artery blockages that haven't yet caused symptoms. And so this is just the tip of the iceberg. We know that you, Maria, and your colleagues at Colgate-Palmolive are world leaders in oral care. So tell us about your vision for the future of oral health and what inspired your consumer campaign, Know Your Oral Health Quotient.
Sure, Nancy. It's really a pleasure being here with you and Jess today, and I think emphasizing the importance of oral health and you know really when we think about oral diseases, right? We recognize there's a connection between what happens in the oral cavity and the rest of the body. And that very often we can see changes that happen in the oral cavity, which we might not usually see, which can really help us to identify something else that's going on with someone's overall health. An example of that might be with diabetes. People will develop periodontal disease or very aggressive gum disease. And if their hygiene looks pretty good, it must be something else going on. So we can interact with the physicians and find out, is there something else that we need to know about? So the mouth is really like a mirror into the rest of the body's health. But we also recognize that if you have untreated oral diseases, like periodontal disease, which is driven by infection and inflammation, that inflammation, chronic inflammation, can increase your risk for other diseases. And Nancy, you mentioned, hypertension and stroke, and, publications have said that you might increase someone's risk for stroke threefold or for cardiovascular disease by twofold. And there are other associations as well with adverse pregnancy outcomes and respiratory diseases and even Alzheimer's. And in having these discussions with people throughout the world, whether they're other professionals or consumers or patients, we recognize a lot of people didn't understand these connections. So we started a campaign, an educational campaign called Know Your OQ. Just like people know their IQ or their EQ, what do you know about your oral health quotient? And so it's really caught on, and people have an interest in understanding more. And we've actually done studies since we launched the campaign to find out that people really, oral health literacy is pretty low, and that there's a lot to be learned, and that when they engage, they actually have behavioral changes which can help them to improve on their oral health. And there's more interest in their oral health when they understand that it is actually not just about their smile and white teeth, but also about their overall health and well-being. And so that's how the Know Your OQ campaign started. And we're very excited about empowering people by educating them and providing the message.
It's really incredible. And I think you're absolutely right. On a day-to-day basis, most people are thinking either about hygiene or appearance. And these health effects are so critical. And I know that we'll all be really excited to hear about the relationship that you have formed with Verily to better understand how these oral health practices can be monitored through your Hum Smart toothbrush technology. Could you tell us a little bit about the study and what you've learned?
Yeah, I think this study in and of itself, Verily is doing an awesome job at following people and improvements that they may see in their health throughout time. And like many other medical studies, there's, not much attention given to the oral cavity. And when we approached Verily and said, what's happening with their oral health? We decided to work together, knowing about these connections. And so this study automatically, talks to the need for collaborative efforts. And we decided to work with people who have diabetes and or cardiovascular disease because of these well-known connections between oral health and these other conditions. And so the first question is, what's their oral status? And indeed, many of them have gum disease, periodontal disease. Then the other question is, what can we do to improve their oral health, and what is the impact on their overall health? And so we will be monitoring these subjects throughout a 2-year period of time. providing them with intensive non-surgical periodontal therapy, gum therapy, and intensive home care. And that intensive home care is driven by connected technologies and will be monitoring what happens not only to their oral health, but to their overall health, looking at markers like high sensitivity C-reactive protein, which is a marker of chronic inflammation in the body, and looking at the impact of periodontal therapy on moving the needle there, because HSCRP may be an even greater indicator of risk for a heart attack than cholesterol, which we talk about all the time. And so what happens when you reduce inflammation through providing oral care with HSCRP in the body? We know that diabetes, right? People who have diabetes and have chronic inflammation, they cannot control their diabetes very well. So what happens to the long-term marker of control of diabetes, which is A1C? So we'll be monitoring their A1C levels as patients get managed for their oral care issues. And then we'll be looking at other markers of risk as well throughout the course of the study. But we've already seen pretty early on in the study that the use of connected technologies enables us to empower those subjects within the study to improve on their oral care. When we give instructions to someone and they go home, they often forget about what we told them to do and how to keep up with it. And they often may think they're doing well and they may not be doing well. But through connected technologies, we can reinforce those instructions. We can help to guide them to provide better home care, which is very important to the success of oral care therapy, just as it is with any other chronic disease like diabetes and cardiovascular disease, where, connected technologies like Fitbits and others are used to help, encourage people to walk more, exercise more, and do things that they can do to help out with prevention. And so we recognize now that through the use of these types of connected technologies, we can drive behavioral changes that are necessary for our success. So, we've seen that as well. And then, of course, I think that we're learning very early on that as we work with the cardiologists in this study and the endocrinologists and others that are involved, the importance of that interdisciplinary interaction.
That's phenomenal, Maria. And, Jess, this idea of bringing multidisciplinary approaches, not just medical specialties, but expertise beyond traditional healthcare providers to understand whole human health is really, part of the beauty of what Verily has created. So tell us from your perspective, Jess, about this partnership and how does this weave into precision health ultimately?
I think you're absolutely right. From the very beginning, the idea of partnerships has been core to us. There's certainly work that we end up doing independently within Verily. But if you think about the partnerships, the very first partnership starts with the patients or participants in our engagements. And that certainly is what we saw with the Project Baseline Health Study. We also partner broadly. We, for example, recently worked with iRhythm on a study watch where originally it was for research, and we continue in that regard, but we are also now clinically deploying the watch where it's a clinical grade device. And as Maria already said, we have to learn how to use these devices out in the real world. And so we're working on ways, for example, to monitor atrial fibrillation in the real world. And again, in a partnership with iRhythm. And what made us so excited about the partnership with Colgate was that, as you already heard, we've been thinking about through the Baseline Health Study, how do you actually link information inside the four walls of a hospital to these devices that we have out in the world, to inputs, patient-reported outcomes? And what we've realized from a comprehensive health perspective, and I speak to this as a cardiologist, it's the only way that we start to push science forward is to think beyond. We know a lot about hypertension and lipids, but the dental health insights have been so important. And so by bringing the best-in-class groups together, and again, that's why it's been so fun to work with Maria and her organization, we're starting to think differently. And by design, we wanted this organization Baseline to continue to be a fostering group where we started, as I mentioned, with the health study. Now we're working with dental health. We built a community during the pandemic. And this is the way research starts to really get access to many people. So again, I think partnerships have been core, and this particular one is emblematic, and we look forward to the continued insights. And as Maria already said, we're already starting to learn as we're on this journey.
It's really exciting. And of course, I'm biased, but I love that it has a focus on cardiovascular disease and diabetes, which of course is a leading risk factor for cardiovascular disease. So Jess, of course, I can't let this program go by without talking about how proud I am of the research collaboration we have between the American Heart Association and Verily on Research Goes Red, where we're inspiring women, especially from diverse populations, to participate in studies and to share their perspectives about health. Talk to us about why this focus was so important to the study.
So we've talked today about the idea of thinking broadly about health, everything from oral health to cardiovascular health to cancer risk, but we also have to think about the populations we engage. So as a cardiologist, and I mentioned, we know that women tend to have a high burden of cardiovascular disease, but that's not always front and center. And so as we thought about women and broad cardiovascular health, along with you, Nancy, and the American Heart Association, we decided to create a cohort, as you mentioned, called Research Goes Red. And it's an extension of this platform that I mentioned earlier. And there are three pieces that stand out to me. One is we were able to create a group of engaged individuals who are interested in cardiovascular health and ask them, what are they interested in? And we were able to do this because we now have new technologies. We've always wanted to do this. These aren't ideas that we didn't have years ago. It's just now we can have a two-way conversation. And what we learned from these women is they were quite interested in weight and menopause, for example. So that was one of the first research studies that we were able to do. And I think you and I are incredibly proud of that. The second piece is we've been able to bring a world-class group of investigators to help solve these problems. As you start to see women raising their hand and being interested in research, that invigorates our investigators. And then the third one is we're moving away from the idea of just having an individual isolated research study to this idea of research communities. So it's not that we have to recreate the wheel every single time. It's not a siloed network of studies, but we can continue to build because, for example, someone might be interested in a study on weight and menopause, but they may also be interested in a study that's looking at the risk of atrial fibrillation, as I mentioned earlier. And again, they think about their whole life journey not as distinct, separate episodes, but it's really what they're experiencing every day. So I am so happy about our partnership, putting people in the center, using new technologies to accelerate research. And I think we're only just beginning. So between all of these different groups coming together, we feel like it's a real moment.
It really is a moment, and, convening across specialties and topics with the person-centered approach is really what has to happen for people to ultimately have improved health and well-being, which is the goal that all of us here viewing this program today share. And one of the really important factors to being able to have ideal or optimal health and well-being is having coverage. And, Maria, I want to come back to you because I know that oral health disparities are really quite prominent, and Medicare doesn't cover dental care. We also know that some racial and ethnic and socioeconomic groups have worse oral care as a result of the social determinants of health, which of course we define as the conditions in the places where people are born, live, learn, work, and play. Maria, tell us a little about how you approach the need for diversity in your connected technology study outreach, and how are you reaching these audiences overall?
Yeah, I think that unfortunately access to care is an issue for us on the oral health side. And certainly, recent discussions about including oral care and Medicare is because of the recognition that oral care is medically necessary for the management of many people throughout their life. So, particularly, we know that during the pandemic, a lot of people were unable to get into dental offices. And we know that probably the worst oral health is found in homebound adults and people in nursing homes. And we know that we can reach out to them and help to provide them with information that improves on their oral health through connected technologies. We can empower them, and we can identify those that are in most need. And we've also found through connected technologies that we can really help people with special needs, like children with autism, where we use augmented reality, which really engages children in general. But in particular, we've heard from parents of children with autism that would very rarely, if ever, want to brush, and would take the many hours of therapy with an ABA therapist to actually start brushing very quickly. So connected technologies, I think, is a game changer and will play a major role in precision health, as Jessica mentioned before, and precision oral health in particular. So we're very excited about the work that we're doing here.
That's really wonderful, Maria. So as we wrap up, let me ask each of you a question. You know, we've been so honored to have this discussion. I've learned a lot, even though I feel like I've known a lot about oral health because of the relationship between oral health and cardiovascular diseases. But I would like to ask each of you to leave the audience with a key takeaway and call to action. And Maria, let me start with you.
Well, I have a few. I'll say them quickly, though. One is it's a research forum. And oral health research is incredibly important. Interdisciplinary interaction for research and by professionals is extremely important. I think improving on oral health literacy is important. So a call to action would be go to Know Your OQ and see what your oral health quotient is. And then finally, the importance of oral health. I think we found during the pandemic when dental offices were closed and it was said that oral treatments were not essential. It is essential. Oral health is essential. And certainly an ounce of prevention is worth a pound of cure. So prevention through brushing twice a day with an active in a toothpaste, using floss, rinsing, using connected technologies if possible, I think are a great way to help prevent diseases. But if you haven't been seen by an oral health professional over the past year, I would say go in and see one, because many of these diseases are not easily diagnosed and may be undetected.
Thank you, Maria. Jess, what about you? What's your key takeaway and call to action?
Sure. So I will build on what Maria said, she's been a wonderful partner, and I think we have melded minds over time. And the key takeaway for me is that the only way we achieve this goal of comprehensive and precise care is accelerating research. And so my call to action is to encourage all of us to raise our hand as research endeavors come about. We need to start thinking about different conditions. We need to think about including many different groups. But I think now is the time to do that. We have people who are interested. We have the tools and capabilities to make this happen. And now we just need to bring together the right groups of people. So my call to action is better research brings better care. And I think that there's never been a better time to make it happen. So thanks, Nancy. Thanks, Maria. It's been a real pleasure talking with both of you.
Well, it has been a delight. I have learned a lot. I know our viewers have learned a lot as well. Dr. Jessica Mega, Dr. Maria Ryan, thank you for your incredible leadership and for being with us today.